pressure itself. Okay. Next, you have to apply the tourniquet. Okay. What is the next step?
Cleaning.
With what you will.
Methanol and cotton.
There are different kinds of chemicals. If you say there is a povidone iodine,
Yes, sir.
which is in topical ointment form and topical solution form also. Okay, you will apply topical solution. By applying topical solution before doing any kind of procedure, remember two things: whether it is a invasive procedure or non-invasive procedure. What does it mean?
The
Under invasion.
cutting of
What is invasive and what is non-invasive?
upper skin or
Sir, invasion मतलब insert.
Yes, inside.
upper that
In simple terms, inside the body, outside the body. Simple terms.
Yes, sir.
Invasive, invasive,
Inside the body.
inside the body.
Yes.
Okay. Before doing any kind of invasive procedures, we have to maintain sterility.
Yes, sir.
Sterility is the very important thing, which you have to be very careful. Why? Because the patient is already sick.
Yes, sir.
Whatever the procedure you are doing, if you don't do properly, it may cause
Double.
some more additional problems.
Yes, sir.
Yes, sir.
So you have to be very careful while doing any kind of invasive procedures. If it is a non-invasive, like you want to put something on the hand, like small cut, you
Yes,
want
sir.
to put a bandage,
Yes.
non-invasive,
Yes, sir.
or any burn, you are applying ointment, non-invasive.
Yes, sir.
These kind of things, non-invasive. Anything you are injecting inside,
Invasive.
it is invasive.
Yes.
Whatever the invasive procedure, you have to maintain sterility.
Sterility.
It is very important and mandatory thing you have to follow.
Yes.
Okay. Next, what is the invasive procedure here?
नॉन इन्वेजिव को एक्स इन्वेजिव भी बोल सकते हैं.
बोल सकते हैं, but usually the term which is non-invasive, we usually call it as non-invasive only. Okay, it is everywhere it is used.
Yes.
Okay. Next, what is the next step?
Invalidation.
No. It is you decided that it is an invasive procedure. You already applied the tourniquet. And remember one thing, whatever the tourniquet you are applying, it should not be more than 3 minutes.
Yes.
Why? Because it may causes ischemia of the skin and whatever the distal part. Okay. So whatever the procedure if you are doing under tourniquet, it should not be more than 3 minutes. Usually prefer 3 to, if it is pressure is not more, then it may extend up to 3 to 5 minutes. Okay. Then what is the next you have to do?
Identifying vein.
You already identified previously that these veins are prominent,
Yes,
and
sir.
you have decided you have to do something procedure in this. Okay. You have already applied what are the povidone iodine solution. And remember this thing, whatever the drugs you are studying, whatever the solutions you are taking, you have to study what is the onset of action. Like if you are doing any topical ointment, कब तक उसका एक्शन आएगा, onset of action, उसका एक्शन कब से शुरू होगा, ये आपको पता होनी चाहिए. एंड नेक्स्ट, ड्यूरेशन ऑफ द एक्शन, कितने देर वो चलेगा, ड्यूरेशन ऑफ एक्शन. एंड एलिमिनेशन, बॉडी से कब एब्जॉर्ब होके एलिमिनेट होगा.
Yes, sir.
जो भी ड्रग हो, ऑइंटमेंट हो, जो भी चीज, हर एक ड्रग के बारे में जो पढ़ते हैं ना, हर एक चीज के बारे में जब पढ़ने के टाइम ये मैंडेटरी है, उसका ऑनसेट कब आएगा, ड्यूरेशन कब आएगा, एलिमिनेशन कब होगा, ये तीनों के साथ मेटाबॉलिज्म आपको पता होनी चाहिए. मतलब जो ड्रग ले रहे हैं वो ड्रग का किस तरह से मेटाबॉलिज्म चल रहे हैं, बॉडी के अंदर कैसे अब्सॉर्ब हो रहे हैं. हाँ, ये चीज आपको पता होनी चाहिए. ठीक है. नेक्स्ट, आपको पता चल गया कि सो एंड सो प्रोसीजर है, टॉर्निकेट अप्लाई कर चुके हैं. अभी बेटाडिन, पोविडिन आयोडीन जो है उसको बेटाडिन भी बोलते हैं. ठीक है. उसका ऑनसेट ऑफ एक्शन 2 to 3 मिनट्स. बट ऐसे छोटे छोटे प्रोसीजर्स को पोविडिन आयोडीन अप्लाई नहीं करते. आईवी कैनुला, ब्लड सैंपल, इसको यूज नहीं करते. सिंपली दे यूज स्पिरिट सॉल्यूशन और अल्कोहल सॉल्यूशन. व्हाई?
Cheaper.
It's not about cheaper. The onset of action is very fast. Like For povidone iodine, I already told you that it may take 3 to 5 minutes.
Yes, sir.
For whatever the spirit you are telling, right, it is alcohol content, which takes less than 1 minute, like 15 seconds to 1 minute. After applying, within 15 seconds, the action will be get started.
Yes, sir.
That's why for small procedures, you have to take this spirit, alcohol, any kind of
Yes.
topical solution. Okay? You have applied tourniquet. After that, you have decided the vein,
Vein.
and you have cleaned the area.
Yes, sir.
Is everything going well?
Yes.
And before all these things, you have to remember one thing: sterility. You are cleaning the area, but not your hands. So